We are live, guys.
Okay, good morning, everyone. My name is Representative Rosemary Rung. I'm chairing the subcommittee for policy for the HB 737 Commission for Pfas Health and Environmental Exposure Study. I need to read a right to know script, which allows us to meet virtually. Today, we will be conducting a remote meeting of the policy subcommittee of the Commission on the Environmental and Public Health Impacts of Perfluorinated Chemicals. Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that 1, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through the platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom, YouTube, and via phone by following the directions and links provided on the General Court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remote-senate@leg.state.newhampshire.nh.us or call 603-271-3043. In the event the public is unable to access the meeting, will be adjourned and rescheduled. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I will now ask Ms. Nancy Harrington to take the roll.
Mr. Benzanian, not present. Representative Bohm, Senator Chanley, Ms. Forty.
Hello, I'm calling in from Litchfield and I am alone.
Representative Notter, Ms. Paradise.
Good morning. I'm calling in from my house in Bedford. I am alone at the moment, but I have a house that is full of family and children.
Representative Ryan.
I am present in my home in Merrimack and I am alone in my office.
Mr. Wimsatt. And I am Nancy Harrington in Merrimack, New Hampshire, and I am alone in my office as well. Roll call is done. We have 4 out of the 9. We need 5 for quorum.
Mr. Raff, correct me if I'm wrong. I think we can still have discussion. We just can't take any action or votes.
Was the quorum decision on the subcommittee something that you guys had come up with prior? Because, or was that just because majority of people there, like 51%, was the idea for 5 out of 9?
Oh, okay.
So, I mean, you can go on. Yes, you can go on, not act on anything. That's up to you. I think by statute, since the subcommittee wasn't in the statute, you're fine to continue right now.
Okay. All right. I think what I sent the memo out or the agenda yesterday or the day before with how we'll proceed. And I don't think there will be a necessary, any votes that are necessary until near the end of the meeting. But I'll just review the agenda We're going to hear from Ms. Harrington about the policy recommendations that came out of the Health Subcommittee. I'm hoping Mr. Badazian will join us to do the same for the Environmental Subcommittee. Ms. Forty, are you on that committee as well? The Environmental Committee?
I am not, no.
Ms. Paradise, are you on it?
No, I'm not, but I know that Chris has sent his notes from the environmental subcommittee. So we do have email access to that.
Oh, okay. Would you mind if he hasn't joined us by then, would you mind kind of taking the lead on just bringing the discussion forward from those notes?
I'll do the best I can.
Okay, thanks. And then we had talked about at the last full commission meeting, some proposed policy areas to discuss. So that will be the third area. And then finally, agenda item number 6, we'll vote on which policy recommendations we want to forward to the Communications Committee to have included in the November report. So are there any questions or additions to that proposed agenda?
I just have one thing, Rosemary. We need to review the notes because I do have one suggested change.
Oh,
from the
okay.
last meeting.
Okay. And yeah, let's do that. We want our notes to be accurate, but we are posting them as notes. They're not technically minutes that would require a vote. Okay, so why don't we go ahead and do that? Let me open up the notes that I have.
Since they're not officially minutes, my suggestion may not be necessary.
What is your suggestion?
I was just going to say, before you made the motion to adjourn, I just want it noted that I left, Nancy Harrington left.
Oh, okay. Oh,
That's
yeah, I'll add that.
Left the
One thing
meeting
that's
at
holding, that's gonna
1:55.
hold up. Oh, okay. One of the things that I want to clarify regarding the notes before they get posted to our website is the attorney for Merrimack had submitted some, I think, 3 points of clarification and correction to comments that Mr. Wimsett made at the last meeting. So I want to make sure that he has a chance to review those and make sure that what we do publish is factual. So he's gone this week. I don't expect that I'll get a response from him on that until early next week. All right, so let's go on with what came out of the Health Subcommittee. What are some of the policy? And we're really just focusing on policy. So we're talking about standard policies, or if there are any recommended legislation that needs to be pursued. Those are really the scope of our subcommittee. So what things fall under that came out of the Health Subcommittee, Ms. Harrington?
Okay, after I read this, I think there should be a discussion about how we proceed with the recommendations from either environment or health. Do we reiterate? Do we just refer to them? Because this is being submitted. This, again, what I'm reading is a draft too, so understand that. Is going to be submitted to the Communication Subcommittee tomorrow morning. So I think there needs to be a discussion that we have regarding what can we accomplish in such a short time. And do we in fact reiterate, tease out, what do we do with the recommendations we do get? So I'll read them now, but I think there has to be a discussion after regarding that general statement. Okay, so the subcommittee, some of these proposals, there were several that had to do with resubmission of bills or legislation that has been put on the burner because of COVID, because of a lot of things. For example, they want to extend the statute of limitation from 3 to 6 years on chemical and PF related injuries. They want to resubmit, resubmission requiring the Department of Environmental Services to maintain a public registry of where certain fire suppressants have been used. That was Bill 1569. They want resubmission of House Bill 1537 relative to standards of the perfluoride chemicals, I can't talk this morning, in drinking water and ambient groundwater. Need more coffee, obviously. resubmission of House Bill 1538, which has to do with PFAS education. They want to be able to propose or compel DHHS to update the 2018 cancer evaluation. And there's more detail. I'm trying to summarize the statements. Legislative proposal to create a chronic disease registry to collect information. And what are the suggestions are special education impacts, endocrine outcomes, cancer, low weight, and all ATSDR and C8 panel outcomes, science panel outcomes, resubmission of House Bill 1274, requiring bottled drinking water sold to the public to meet the standard, the MCL standards, resubmission of House Bill 661 relative to claims for medical monitoring. They want to propose the additional member from Londonderry, one elected and 2 community representatives. And we already know that the environment had made that suggestion. Chris had talked about that at the last meeting. The establishment of a PFAS blood test registry. And the other 2 are sort of up in the air. I'm not sure. They talked about proposal for rental properties. I'm not sure. That was going to be teased out more. So again, some of these are just resubmissions. Now, my discussion after this is we have these recommendations from the Health Subcommittee. We're probably going to be receiving recommendations from the Environment Committee. Now, do we summarize? We pull those together, make decisions about which ones? Do we reiterate, or do we just refer to? Because I think that opens up a whole other discussion. Because this is what's going to be submitted.
Does anyone have any comments regarding that? Okay, well, let me go. One of the things that I think is important for us to do is understand the scope of this commission, because any policy or reports that we recommend and submit need to be consistent with what was in the legislation that established the commission. So I just want to refer to the actual text of House Bill 737. It goes into, it says, the commission's study shall include, but not be limited to, obtain information necessary to delineate the extent of PFAS drinking water contamination from airborne soil and groundwater releases, assess and implement steps necessary to investigate public health impacts from PFAS exposure to air, soil, and drinking water, assess sources and impacts to surface water from wastewater and other discharges from the Merrimack, New Hampshire St. Gobain plant, assess whether soil regulations are sufficient to contain contaminated materials, investigate and analyze the findings and related materials, develop prioritized governmental and community actions, refer the progress made by state and federal agencies, if appropriate, and their partners, delineate the potential roles and responsibilities for municipalities, state agencies, and their partners, communicate with the public about the environmental and public health impacts of PFAS exposure, investigation, and analysis, assess whether current rules or regulations are sufficiently protective of public health and propose legislation is necessary to protect public health, recommend legislation is necessary to carry out the charge of the commission or resulting of any commission findings, assess whether current penalties and regulatory controls are sufficiently protective of the environment and public health, and recommend changes necessary, and then to assess agreements between the state and St. Gobain and propose additional actions necessary to achieve the charge. So what I'm reading from this RSA, it is pretty broad. It's not as a defined scope that we need to be as cognizant. I can't talk either today.
You need coffee.
I have to say contemporaneously again. I'm gonna be in trouble. So, so I think just from the things that you said, Ms. Harrington, that I think all of those are in the scope. I mean, the charge is pretty broad. So then the question remains, what of those things do we feel is appropriate? Do we think that is relevant and credible to support that charge. So if we were to look at the first one, which is to extend the statute of limitations to, I guess, claim damages or establish damages from 3 to 6 years. But my only response to that is I wonder where the 6 years came from. Do you know?
I don't know.
All right, because if it's just an arbitrary number, I would prefer maybe, unless we know how that number was derived, I would prefer to say just extend the statute of limitations for PFAS claims.
It open. Mhm.
Yeah, I would agree with that.
Okay. All right, so we're gonna move along then. We'll check that off. And we'll just keep it open, just extend the statute of limitations. I guess it would be the right language would be to claim damages from PFAS exposure.
For PFAS related injury.
Okay, that's a good one, yeah. PFAS related injury, okay. All right. Okay, the second one is to establish a public registry of firefighting foams. Was that?
Yeah.
You know,
To
PFAS
maintain a public registry of where certain fire suppressants have been used.
Mhm.
House Bill 1569.
Mhm. And I think that's also in the scope of the legislation for the commission, because it does talk about to understand the extent of PFAS exposure. And we know it's not just in New Hampshire, but globally, there has been contamination due to firefighting foam containing PFAS. So does anybody, I guess, does everyone agree that we want to recommend in our report that the state of New Hampshire maintain a public registry of where those firefighting foams have been used?
Yep.
Okay, moving on. And then could you go over the third one again, Ms. Harrington?
Resubmission relative to standards of PFOA in drinking water and ambient groundwater, House Bill 1537. And I don't know what that relative to standards, I really don't know. That's not clear enough.
Yeah, let me check, because I think we did a lot of that. That might have been included in that PFAS omnibus bill. Let me,
I do have notes from the meeting. I'm quickly
okay.
looking. Must be from a previous discussion. It's not in these minutes, or it's not in the report with more specifics than that.
Yeah. Yeah, I have questions about that, just because we just established new MCLs for
Correct.
drinking water. I don't really know what specifically in that legislation we would want to change or recommend. And so why don't we,
Hold up on that one. Just hold up on that one.
Yeah, we'll just let it go.
I think it might be clear. I'm wondering if that's related, because I know that Representative Murphy had submitted another LSR. I'm just not sure. It just wasn't clear to me exactly, just like what you said, you know, that we did pass the 1264, the omnibus bill. So in looking at what 1537 had, you know, it's just not clear what is the additional ask there. I know that there was some discussion about, you know, how only some of the identified PFAS that we have, we've only identified a small subset of the entire scope. So I think that might be a piece of what they're trying to get at here, but we might need more information.
And I know the 4 PFAS molecules that were regulated in the state of New Hampshire and included in the MCLs, those were determined from previous studies. national studies about the contamination, that they were well characterized. There were recommended limits from the EPA. So, you know, it may be adding those other ones, but I think maybe we should just keep that open for now. And
Now that you mention it, I believe that is exactly what it was.
right,
Was
I
extending the
know
type
there's concern. Yeah, there's concern with Gen X,
Right.
but I believe when correct me if I'm wrong, but I think at our last meeting, didn't Mr. Wimsott say that 1264 does accommodate any new PFAS that comes, it, you know, that needs to be regulated, that the legislation that passed kept it open, that the DES could create new MCLs based on other PFAS that become known. Does anybody remember that?
I don't.
Okay. All right. Well, we'll keep that open. I don't think we're in a position to move it forward or not move it forward. Although what we could do is instead of recommending a specific bill that Representative Murphy's bringing forward, we could say that we recommend a policy that any new PFAS that pose a risk to the public or health or environment need to be regulated and have maximum contaminant levels defined. You know, so it may say we're in support of 1537, but you know, it just keeps it open that we want a policy that the state mandates regulation or regulates PFAS chemicals that may go beyond the 4 that are currently subject to MCL regulation.
Yes, I would agree with that.
Okay, so why don't we use that for the third recommendation, Ms. Harrington?
Okay, I'm just trying to write it down.
Okay.
And then I did
So-
put a link to 1537 in the chat.
Oh, okay.
I tried to get the link that kind of shows some of the changes in the language that they were recommending. And it seems like it is related to not naming those 4, but making it the more broad, any precursors or any substance within that entire class and not specific to those 4 that were
Yeah.
listed.
So any new PFAS chemicals that are beyond these initial established 4, right, needs to be regulated and minimal standards established,
Yeah.
MCLs.
Yeah.
Right? Does that sound
Yeah.
right?
Yeah, I think that sounds good. It says, I'm reading the law. It says this section shall only pertain to PFAS for which at least one study has been conducted in accordance with generally accepted scientific principles and demonstrates that PFAS of concern is known to cause or may be reasonably anticipated to cause acute, chronic, mutagenic, reproductive, blah, 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 blah. Yeah, you know, I'm actually thinking that just the broader support for a policy or legislation that regulates any PFAS that becomes known in the future to be hazardous. I think just that kind of a statement is appropriate for us to recommend. The reason why I don't want us to say specifically that we'll support this bill is that once it goes through the legislative process, it may be amended. And it may come out different than how it was introduced. I think we want to state a policy of where we want things to go, not necessarily specific language, because that may put us in conflict with amendments that may be proposed later that make it a better bill.
And yes, I think your comment to make it a little bit broader is much more effective because we're not limiting things in the future.
Right. So our policy is really more about the intent. You know, our intent is to make sure not just these 4 PFAS become regulated, but any in the future that pose a health or an environmental danger. Okay.
Okay, may I reread this so that we,
Yep.
okay, just make sure. So we're just revising it, that the new policy be established that any PFAS chemicals to be identified in the future that may affect health or environmental, I don't have the word, I'll put concerns for now,
Mhm.
needs to be regulated and minimal MCLs established.
Yeah, or just MCLs established. Yeah.
Does that sound right?
Yeah.
So that's
It
going
may
to
get
be,
it may get wordsmithed a little bit in communications committee, but I think we're clear on what the intent is.
well, part of the problem is we have to have this submitted by tomorrow morning,
Yeah.
which is
Yeah.
a
Well,
whole other discussion.
right. And we'll submit it, and the communications committee will probably, I think, as long as we make our intent clear, they may wordsmith it a little bit. Okay, so we're going to move on now
That's number
to
3.
now that other bill. The next one is 1538 PFAS education. I should have pulled these bills up before we started. Let's see if I can get it. Nancy, can you kind of summarize the discussion on that point?
Excuse me. Actually, that's been some discussion about physicians being provided information, also encouraging them to educate their patients. They need to be educated, but they also need to be able to provide information to the patients regarding PFAS in their systems. Now, we have discussed the Medical Society of New Hampshire. There's been some discussion with them, but there's been no concrete action by them as yet, as I remember. So this basically has to do with physicians and medical areas within the state to become educated regarding PFAS implications, health implications.
Okay, because I'm reading from the summary of the bill. It says creating a commission to develop and implement environmental education, outreach, and training programs and initiatives for qualified healthcare professionals relative to environmental toxins and health. So again, I think we should support a policy that the state should be responsible for educating healthcare providers in the state regarding the health implications to PFAS exposure. You know, just something general like that. Because that bill is just environmental toxins. I think we just want to recommend any health impacts from PFAS exposure. So again, sort of what the point we just talked about with the MCLs of future PFAS, we'll keep this kind of broad. We won't recommend a specific bill, but support the need for education of healthcare providers. Everybody okay with that?
So you're saying just supporting the policy versus supporting legislation?
Well, I think I would say that we recommend that the state institute an educational program for healthcare providers regarding the health impacts of PFAS exposure. I mean, if it's a bill that passes, right. I mean, there are some things, there's a lot that goes on in the state that happens not because a bill was passed. You know, I mean, the state could just adopt a program, they could put it into rules. You know, bills aren't solutions to every problem. Sometimes there's other things that can happen that it's a lot more straightforward.
Yeah, it's about getting to that end goal. We want
right,
them to be
exactly,
educated, informed, the patients to understand. And if that's through establishing this commission, and that's wonderful, but there might be other ways too. But it's the policy subcommittee's recommendation that end goal is part of what we're after.
Exactly. And you know, there may be other things that exist in the state, even maybe in statute, about a health there may be a health education commission. It may be under standards, professional standards. I don't know, but we just want to make sure our intent is that we want healthcare providers in the state to be educated on the health implications of PFAS exposure so they can recognize it, understand what to expect, maybe get into a medical monitoring program for that patient. But I think we know what the thing is. Okay. All right. So we've got that. The next one is DAHS 2018. Nancy, what was that? Oh, cancer. It was.
Cancer evaluation.
Okay.
Yeah, that's something that has been lacking. Apparently, there is information in the original legislation. Again, I'm not as up on it as you are, Rosemary, regarding communication, which was one of the major issues we talked about. Communication, not only from DHHS, but DES, about various things that we should be communicated with. For example, I know I'm going in circles, or at least it feels that way. It's already legislated, my understanding is that anything that has to do with PFAS exposure be communicated to the commission, and that's not happening. And this was one of them.
Okay.
How cancer is impacted in the Merrimack area community, and using comparisons, whether it be state or national. That's been very late. And some of it has to do with COVID. We acknowledge that. But some of it does not. It's just not, communication is not being followed through as should be. And this is one of those.
Okay. So
I do think we could make a generalized statement supporting that concept, that we encourage the state to follow through with the communication that needs to be done between all departments and the commission. Something like that.
yeah, I'm just going to throw something out there that we urge that the State Department of Environmental Sciences and the Department of Health and Human Services and any other parties that collect and manage information pertaining to cancer rates provide that information in an accessible and transparent way so that our commission and others that are working on health-related topics can access that information readily to use in their work. Something like that. Does that make sense? It's broad, but I think instead of saying
I can listen to this later. Good.
Yeah, I think we all, I mean, correct me if I'm wrong, but I think we're all on the same page on this. We want more accessible and you know, it may get where we want a clearinghouse of cancer related health data to be shared transparently and have easy access to it so that our commission and others that need to access the type of information to do our work has access to it. Is that pretty much, that's the intent? If you capture that, Nancy, that's good, because we don't have to do the wordsmithing here. We just have to get the intent down so that when the communications committee sees it, they know what we want to have done, and then they can then, you know, put it down in a way where people reading that will understand clearly what our intent is.
And I'm on the communications subcommittee, and we're meeting on Friday morning. So being a party of this discussion, I think will then help Bridget.
And I'm on the communications committee too.
Okay,
So
cool.
Yeah.
I think we're good.
Yeah. And you know, I come at this because I had a career in communications, and it's always better if you only have one group doing the wordsmithing. So if we wordsmith here, we're wasting our time because they're going to wordsmith it on the communications committee. So as long as they understand the intent, you know, let and that's their responsibility to put it into words. Okay, so we've got that. And then the next one is the chronic disease registry. Nancy, is it to establish one in the state? Correct. Okay.
Correct. And those are A, B, C, D, E are just suggestions related to PFOA exposure.
Did the committee discuss any model that might exist in other states or the federal government for a registry? So we would be inventing the wheel here. Okay. Well, I think that actually goes hand in hand with the previous one about getting information about cancer rates and everything. I wonder if we can combine that. So to establish a registry of a disease registry that is easily accessible, is comprehensive to diseases that are linked to PFAS exposure. Can we kind of combine?
Well, I believe the one before really has to do with the process of communicating, where this one is specifically the establishment of a registry. So
okay.
it is different. Again, the previous one was you're supposed to tell us about any information that you receive in your department about PFAS, whether it be health impacts or environment, and you're supposed to forward that to this commission, and that's not happening.
Okay.
And I think a part of that was also regularly updated.
Okay.
So for the
It's a
most
process.
It goes beyond disease
Right.
registering. It's not just communicating that, it's anything to do that would provide information about PFAS exposure impacts.
And I believe that's in the legislation, and that's where the frustration is that, so it's a matter of encouraging following through with what's already been established.
Yeah. Okay. All right, we've got that. I think that makes a lot of sense too, having that registry. Can we accept that as a policy recommendation, that New Hampshire establish a chronic disease registry?
Now, when we read our report, that's a fairly lengthy recommendation, which is fine. But do we reiterate that, or we just accept and agree with, or encourage and refer to it? Again, it's a process issue. I mean, we could say we agree with the F recommendation from the health committee. We could say that.
Yeah.
Because they're already going to have this.
Yeah, because it'll be in, we would just cut the communications committee. We would just say, we want you to take the recommendation F in its entirety as a policy recommendation.
Okay, but what does our report have to reflect?
Well, we don't, our report, we can just say in our report that we recommend a health registry of chronic disease, a chronic disease registry. Please refer to the health subcommittee report F.
That's exactly what I'm talking about.
Yeah.
instead of just copying it.
Right. Like, we don't want to wordsmith. They've already done that. So.
And we already have this.
Uh-huh.
So we can refer to it. We recommend as stated in. Okay.
Right, because I think some of it goes back to, needing to establish what is actually going on. What are we seeing? You got to collect the data, and saying, so as the policy subcommittee, we agree that this is foundational, that this needs to occur.
Okay.
I like that word, foundational concept.
Yeah. Okay, so the next item is bottled water. There is a LSR that's been submitted. I'm actually co-sponsor on that, to set PFAS limits on bottled water. And, I think I don't think we need to speak directly to the bill for the same reasons about when we discussed earlier about 1537. I think we should just say that we understand that PFAS exposure occurs in many different ways, not just from tap water, but from all water that's consumed by our residents, including bottled water. And bottled water should be held to the same standard as drinking water. And maybe the communications committee will say, yes, and there is a bill that's going in that we support. But I think we're really looking at, we want a policy or legislation that applies MCLs to not just drinking water from municipal systems, but to all sources of drinking water, including bottled water. Okay. Then we have the next one is it 661? I don't know why I can't read my writing today. I think I do need more. Oh, claims for, is this claims for medical monitoring? Nancy, the next one?
Yes. Yes.
Okay. So can you read the specific recommendation on that from the health committee?
I don't have anything more beyond that,
Okay.
unless, Nikki, you're really good about pulling up. Again, I did not do it either, Rosemary.
Yeah, that's okay. I can try to get it up too.
House Bill 661.
Yeah.
When, yeah, with COVID and how everything kind of gotten, sliced and diced and trying to figure out the best way to, in a insane set of circumstances. I mean, I know that the medical monitoring, it did go forward in a separate omnibus bill, but then that one was vetoed.
Mm-hmm. Yeah, again, I think maybe
it's more about relative. Yes, this was relative to claims for medical monitoring, 661. I mean, again, so as far as the policy subcommittee of this commission, regardless of what has taken place, the intent of, we support medical monitoring, we support the mechanism.
Yeah, I'm wondering how specific we should be, whether we should say something that we recommend the state establish a medical monitoring process to track the chronic effects of PFAS exposure once it's been initially identified by a healthcare provider.
We've already done that with number 6.
Yeah. So, but I think with the medical monitoring, the focus of that, I think in the legislation, was to have the claims against the source of the PFAS. So Saint-Gobain, for instance, would be responsible for paying for medical monitoring to track chronic implications from PFAS exposure. So, for instance, those people whose PFAS was measured to be high in their blood from that initial study, just for example, Saint-Gobain would have to subsidize the cost for that person to be monitored annually, at least, for any chronic effects that show up from that exposure. So we might, maybe it might be better for us just to say that we strongly recommend that the state established through either statute or rule for companies responsible for PFAS exposure to assume the cost for long-term medical monitoring. What do you think about that, Nancy?
I like it.
Okay. Because I think if we go into more detail, we're going to get into way many details. I think we just want to say who's responsible for the exposure should be responsible for medical monitoring. And as far as, okay, what blood levels trigger the medical monitoring responsibility, I don't think we need to go there.
That's what will be, that's part of the regulation.
Yeah. And we may find that as this commission works into its second year, we may get more research that comes out of other studies that tells us, okay, at this blood limit, this is what you really have to check for. So
which is exactly the communication we need to receive.
Yeah, we need all that research. Okay, So we'll do a strong statement on supporting medical monitoring for patients whose the source of the PFAS exposure has been confirmed, that they would have to be, that party would have to be responsible for those costs. Okay, and then the PFAS blood test registry. I'm assuming that's so that we can keep track of, would that tie into the medical monitoring? Was there a discussion with that, Nancy?
It was not. These last three were very included last minute. And Mindy, who takes terrific notes, her computer skills are unbelievable.
Mhm.
All of us are watching her do this live and we're just going, how are you doing this? Anyway, those last three things were added at the last minute that she was going to put more detail in for the report.
Okay.
Again, this is just draft. But
Okay.
right now, there is no registry of PFAS, which would be useful for studies in the future.
Yeah.
Right now, there is
It
nothing.
would go beyond medical monitoring. There may be technology advances that show, hey, if.
And
you know,
longitudinal studies,
that-
those kind of things. Right?
Yeah, okay. So I think we can say that we support a PFAS blood test registry so that information that has been gathered from blood testing can be retained in the event future research and technology provides more information on the implications of that PFAS. I don't know. I don't want to wordsmith.
That's right.
Yeah. But just so we can keep data on those blood tests, because we could do a blood test for a short term. It's sort of like when the MVD blood study, we did it to
That's
find
exactly
out,
the
okay,
point.
this is the extent of the PFAS levels in people that have been exposed to MVD water. But then, okay, now we know, but maybe that information can lead to other information that we don't know we need yet. So at least keeping the registry of, it doesn't need to be on the individual to drive like any individual action like medical monitoring, but it could just provide information later down the road as more is known. We may want to refer to that.
So we concur and support.
Yeah. Yep, I think so. Any other information on that? Okay. And I think the last one has to do with rental property, so that if someone's renting, that there has to be required if someone is renting property where the water exceeds the MCLs, that they have to be notified.
Okay.
Is that what it
makes sense? Yes, that makes sense.
And actually, I would actually recommend, and give me some feedback on this, that any residential, any new resident of property in New Hampshire, there has to be disclosure about whether the drinking water supplied through the tap meets state standards. And we could say for instance, and I'll give personal experience. I have some new neighbors in my neighborhood, and I went over to introduce myself to one of them, and she said, "Oh my gosh, I just heard there's something wrong with the water." And so I gave her, she never knew about it. No, the realtor never told her, the previous owner never told her, about this problem we've had with water. They had moved here from out of state. So I think on real estate disclosures, you have to state if there's a radon issue, or, there's things you have to disclose in order to sell a property. I think water quality standards, whether the tap water meets water quality standards, should be part of the disclosure.
Part of the thing with that is that the MCLs have just recently changed. So up until then, we were within the standards in Merrimack. We were below 70.
Right.
So when the MCLs changed, that's when, so I agree with you. But prior to that time, the rationale was, well, we are meeting standards.
Well, I have to say, there was an impact of this, and it had to be disclosed, but in a different way on real estate. It was just talking about groundwater management zone, and that's how it was labeled on real estate disclosures. And so if you're not educated, you don't completely understand what that means. And I think that's where the disconnect is when it comes to, people new to the area and new to the neighborhood. And at least for Bedford and where are the 61 homes that got water, they don't have to disclose anything anymore because they do have access to a water source that is less, but people still are poorly informed in the community about it. So I stand with that recommendation.
Okay. So Emma, do you think it should be, because what I'm saying, it should be disclosed if you're selling a property, but it should be disclosed if you're going to rent a property too. And that water standards disclosure should include, there needs to be a water standards disclosure. And it also needs to include PFAS standards.
Completely, wholeheartedly agree.
Because I do think
And
that like arsenic is a big issue too in areas of New Hampshire.
so I guess this is a question, since we are talking policy, when homeowners get a water test, you're right, about arsenic, and they do this testing, are we able to encourage legislation to be passed that a PFAS level be disclosed? Because I know I received a phone call from someone in Bedford saying that she got a water test, but she wasn't sure if PFAS was tested. And I said to her, I'm like, I could probably, without even looking at it, guarantee it was not tested, because that is not a common water test that is done. So I would like to encourage us to make legislation saying it is required for a water test with this purchase and sale of a home or rental of a property. I agree with you.
Yeah. I think, yeah, let's go and say, to make that, bill of sale or the purchase and sale agreement or whatever, or a rental agreement, that the water needs to, PFAS levels need to be shared with the new resident, even if it's I'm sorry, I'm talking I don't know where my mind is today, but
Let's call brainstorming.
yeah. So I think if, for instance, if I were to sell my home, I would have to submit the latest MVD water analysis report. I'm on MVD water.
I feel it's akin to lead disclosures in homes that were, built pre and post, what is it, 1968. And I think that this is just the new kind of lead disclosure and testing that needs to happen when it comes to all of that you're talking about with the house.
Quick question. Again, I've not been involved with any real estate transaction. Presently, purchasing a house, are you provided water analysis as part of it?
No.
So that really is a fundamental issue. Go ahead.
I just bought, we just moved 2 years ago. And yes, you can ask for a water test, but and I'll confirm this, I don't think it's officially required, but because we knew the water issues that we had, we actually requested, and for the purchase and sale required the results of a PFAS test.
Okay. So I guess my concern is I agree with you, but it should not only be PFAS. Perhaps there needs to be a generalized statement about required disclosure of any water analysis with PFAS included.
Yeah.
Because there should be, whether it's arsenic or Rosemary, you and I get the reports from MVD, and everyone's frozen on my screen at the moment.
Oh, am I still frozen?
Rosemary is frozen.
I am?
Nikki, you're not, you're moving. Anyway, I can still listen, I can still hear everybody.
Okay.
So, but you know what I'm saying there, perhaps we can do a generalized recommendation that it be required in all real estate transaction, whether rental or purchase,
I like that.
water standards be provided.
Yeah. Yep. I agree with that. It may be, Emma, when you bought your place 2 years ago, did you have a radon report? Is radon now required for sale of property?
So we did get all of those reports. I just texted my real estate agent that she's a friend and we used her, and water testing is not required. So
Okay.
just put that out. And I will ask her right now about a radon report if you would like.
Because I think radon may have been added. It's not, I think the intent is that renters and new owners of property need to have, they deserve to know the quality of the water. That should be quiet. It shouldn't be their responsibility to seek out information about the quality of the water, that should be a given. I mean, there's other things on that disclosure form that are far less serious than the quality of water. So I think, I think it makes sense. So we'll go, and I think we understand enough. I think we know to put that forward, or how it will be worded.
And just to follow up, radon is not required, but it has become more of a norm. She's going to confirm if it's a requirement for VA and FHA loans, and it may become more of a requirement on the person issuing the mortgage.
Oh, okay. Okay.
But not currently for a real estate transaction.
Okay. All right. All right. So that takes us through health then. Environmental. I'm sorry.
One thing we did not do, we passed over, was the proposal to add the Londonderry members.
Oh yeah, that wasn't, was that on? Yeah, I have that listed too. Actually, before we get to environmental, some of that is captured under the general things that we talked about the last meeting, and also that came from the commission meeting. Let's just knock off. I think we're all in agreement to have the commission expanded to include a official from Londonderry and a resident from Londonderry.
Okay, we're talking about one. The health committee, subcommittee suggested one elected and two community. What do we have in the commission now? The community members, are they two or one?
It's just one resident.
Then it should be the same then. Okay.
Right. I think just one and one, because I mean, the commission would be too large. Because Nikki, you're the only resident from Litchfield, right?
Correct.
Yeah. And I think Rebecca is the only one from Merrimack. Emma, you're the only one from Bedford. So I think just one and one is going to be good.
I think that must be an error.
Okay, yeah. And then the other thing that was on my list from the previous commission meeting, the full commission, was educating health providers. I think we've already captured that already, so I'm going to cross that out.
Yeah.
The other thing was regarding food regulation, regulating or creating a PFAS standard for food. I think what we should say about that is the amount of the question of whether setting PFAS regulations in food was brought up and discussed in the commission, but we need to have more input from the Department of Agriculture. We also have to understand if the testings of food for PFAS are accurate and precise in that measurement. Because I think Mr. Wimsatt said there are two issues with that. One is that it's not under DES purview. And the other thing is that the testing protocols may not be certified yet to be that there isn't an accurate analysis for PFAS in foods. So we could just say, I think that it's mentioned, but it is a mode of someone ingesting PFAS. But we would need to get some engagement with the Department of Agriculture probably in the future about, their opinion on that. Does that make sense? Okay.
I had gotten an email from Representative Thomas sent yesterday that had like a couple, it was labeled like uncompleted tasks. I wasn't clear if this was meant for the policy subcommittee or where. Did other people get that email?
I got it too, but I wasn't really sure what we're supposed to do with it, because I understood we're supposed to taken information for ourselves and also from the health and environmental subcommittees to pass on to the communications committee. So I really wasn't sure of that. I just thought we probably have our hands full with just what we're getting from health and environment and our own. Did you feel like we should take any action on that, Ms. Forty?
No, I felt similarly. I wasn't sure exactly if it fell in, but some of the things that we've already brought up, I didn't have that list from the health committee, so
Mhm.
I think we're good.
Okay,
There was an acknowledgement of those things that we wanted to do that we have not done yet. And that's what the listing you're saying, Nikki.
okay. And this isn't, I mean, our commission isn't over. So, I mean, if there are things that are uncompleted that need further discussion, we can definitely capture them after this report's going to be final, going to be submitted.
I do think we have to, when we write up the report, there has to be an acknowledgement of the limitations that we're under
Yes, I'm going to capture that too.
because of the COVID and all
Yeah.
the rest. And we've only had 2 meetings, and which was appropriate because we needed to wait for the health subcommittee and the environment subcommittee to come to terms with their own recommendations before we could respond to that.
Yeah.
So I think it's very reasonable. We need to, 1, acknowledge limitations, 2, say we've had 2 meetings,
Mhm.
and the recommendations that we are forwarding are based upon the analysis of review of the environment and the health subcommittees,
All
which is
right.
pretty good. We've got 12 of them.
Yeah, no, definitely. Okay, I want to go back to some of the things that we discussed at the full commission meeting. Assess comparative health impact rates. I think when that was discussed, Ms. Mesmer brought it up that having the data to say New Hampshire has this rate of breast cancer and nationally it's this rate, and a community that has PFAS exposure has this rate. You know, that information is important to put in perspective the impact of PFAS exposure in those communities that suffer from it. So I think that can get tied in to, and it may already be tied into what you said, Ms. Harrington, about the communication with our regulatory agencies that, you know, we need included in that communication is that we need to have a clear understanding of the cancer rates as they pertain to PFAS exposed communities, the state in general, and the national rates.
Yeah,
Can we include that in the communication rather than be separate? It's not like they're creating the, I mean, that data is available. It's just, how do we get it?
Correct. And that was the concept under the update the 218 cancer evaluation to include newer data. It's all the same.
Yeah, so right, to include newer data and also on a, we'll amend that to include newer data and also comparative rates on local, national, and local, state, and national levels. So I'm going to cross that out since we're going to be capturing it in that other recommendation. And then, okay, everybody's okay if I move forward to the next one? And the next one is limiting ongoing emissions. And I think this is where we have to have some strong language that the commission strongly recommends that any emissions of PFAS to air, soil, or water, the state be aggressive in stopping that those emissions. We're heartened by the fact that the variance request by Saint-Gobain was denied and that they will be compelled to meet the new standards come February 1st, but that we want the state to be proactive in prohibiting any release of PFAS into the environment. It wouldn't really be a law, it'd just be a really strong statement. And I'll give you an example. There are some communities where car washes are putting in their waste into their septic system or into a wastewater treatment system, and they're spreading PFAS because that's the undercoating. Merrimack stopped that. They have to haul that off and have that treated. They can't take it and put it into our wastewater treatment system. But how many communities is that happening to? So I think the state has to be aggressive in ensuring that PFAS discharge into our environment stops. And they need to work toward that goal. You guys okay with that?
I think, yeah, it has to be strong. It has to be.
Yeah. So it wouldn't be legislation per se, but it's like, and I
Just
think the key
generalize.
word there is to be aggressive, to be proactive, aggressively proactive, because sometimes you look at DES, it's Department of Environmental Services. It doesn't say Department of Environmental Protection. They provide services, but to really go in, even if there's not a law, and yet, to say that you need to do this. And if there needs a law to compel someone to do it, then they need to make sure that that goes through the legislative process. Okay. All right. And then the last thing I have from our general commission meeting was sample retention. And I believe that has to do with the blood samples from MVD. I think we kind of got that covered under the PFAS blood test registry.
Yes.
We could probably expand that to mean, to maintain a blood test registry and retain samples as necessary that could provide future information. I know Dr. Bean that was at the last meeting, she said that, samples decompose and it's very difficult to maintain them. We need to know what kind of tests would be run, because that would then provide us information on how to store those. We need a new freezer. I mean, she did show us the problems with just retaining these samples indefinitely when there's no purpose stated.
In the Health Subcommittee report, that is addressed in terms of what has already been accomplished. In a letter dated March 6th from the Public Health Lab, that's exactly the information that you had talked about, Rosemary, about what they needed. And we are in the middle of preparing a response letter. Let's see how it says here. The letter we received from DHS included a cost estimate for the associated staff, resources, and equipment for this work. Maintaining of these samples are determined to be of great importance to the subcommittee in order to continue monitoring for PFAS contamination responses and for any possible correlating state and national studies now or in the future. That's in response to maintaining those blood samples.
Okay. All right, so we can capture that in with the blood test registry, so that sample retention would be captured in that, because it would be our intent for retaining those samples is covered under what you just said, Nancy.
Right.
All right, so that's good. All right, so we've gone through all of the recommendations from the Health Subcommittee. We've gone through all the recommendations that came from our full commission meeting. The only ones left to do are the environmental ones that came from that environmental subcommittee. And Nikki, do you have any that we should go over on that? Did you get a copy of that environmental subcommittee recommendations?
So I did not. I think Emma might have.
Oh, okay. Emma, did you?
So I'm looking at Chris's notes that he's
Okay.
submitting, that committee is submitting to
Okay.
communications. Would you just like me to go through with that?
Yeah.
Okay.
How many are there?
So I can go through the first, I can go for the first 3 recommendations fairly quickly. And the 4th one goes a little bit more into detail over recommendations.
Okay.
Okay. So the first one talks about sources of environmental contamination that the subcommittee identified, study, and will continue to study the following sources of contamination originating from St. Gobain facility, and talks about ongoing industrial process, stack, roof, plumbing, and drainage system residue, soil, surface water, groundwater, stormwater, and wastewater. Okay.
Okay, got it.
Second is talking about the migration of environmental contamination. Continues to identify, study, and continue to study the following pathways of migration. Again, originating with Saint-Gobain: air through stack emissions, water being discharged into the Merrimack River and tributaries in the vicinity, building runoff, surface water, stormwater, wastewater, groundwater, and groundwater migration from air deposition of PFAS contamination in the surrounding communities, and it's further defined, and soil, removal of contaminated soil from the Saint-Gobain facility and surrounding properties is presently subject to and limited by hazardous waste disposal procedures. The third point was remediation. The environmental subcommittee studied and will continue to study and following the remedial actions pending or taken to mitigate the migration will be air, using the regenerative thermal oxidizer installation, but it's pending completion of February 2021 and time required for commissioning and placement in service equipment to be determined. HF treatment, it is not required by air permit, but it's subject to pending litigation. They called it out, at least in here. B, drinking water, municipal systems, looking at Merrimack Village Water District, the activated carbon filtration at wells 4 and 5 are in progress. Municipal water line extensions and connections, all agreed to, projects completed. Residential well sampling, the provision of bottled drinking water, if results exceed MCL established by RSA 485-16E by NHDES. So they're going to proceed and resume per the Golder Associates work plan for residential well sampling within their current groundwater management zone in the outer boundary defined by Saint-Gobain consent decree, and then voluntary PFAS testing of new wells statewide recommended by DES. So those are the three I believe we've discussed in our full commission meetings. And if you don't have any questions, I'll continue to the fourth one. I read through those quickly, I know. Do you have any questions on those three?
Well, the one thing that kind of came to mind, Ms. Paradise, when you were speaking about those three, it kind of touched on what we're looking at from the health subcommittee for better communication. And I feel maybe if we either included in that recommendation regarding the health communication, we could expand that to environmental communication. Because I feel sometimes DES may be privy to information on technology that do some of these remediations you talked about, but we don't know about them. So if we don't know about them, how can we recommend them? So
correct. Maybe
when we talk about what recommendations from a policy point of view we should include in the report, it should be to encourage DES and DHHS to provide communication on all in trends in environmental remediation for PFAS, in addition to a lot of the health related information that they get. I know I'm not wording that correctly, but I think you get my gist.
No, I think that's fair. And I'd agree with that. And I'm reviewing the fourth point, which does not talk about that in their further recommendations.
Okay.
Any other questions, or I'll just move on to the fourth point?
Go right ahead.
Okay. So the fourth one is, recommendations in addition to the continued study of PFAS environmental contamination, migration, remediation include the addition of Londonderry to study area. And if you have these, the RSAs are included, and Londonderry representation on the commission. Monitor HF scrubber appeal which is scheduled for a hearing December 2020 and have follow-up to be determined based on the outcome. Monitor Saint-Gobain air emissions subsequent to regenerative thermal oxidizer installation. Evaluate data generated by the work plan for residential well sampling and whether expansion of a residential well testing program beyond the groundwater management zone outer boundary is advisable. Evaluate a program for long-term tri-annual well testing in study areas of the hydrogeological interest. Compile and analyze statewide new well PFAS test results. I think this one's a good one also to include. Evaluate whether to initiate a parallel study to include the communities of Nashua, Amherst, and Hollis impacted by the, was it TCI site?
On that last one, I remember the conversation we had with Mr. Wimsat that anything that comes out of this commission relative to Saint-Gobain will benefit the TCI thing. My
Okay.
preference would be to keep that out, just to
Okay.
keep. It's not preventing it from happening. It's, I mean, we could still advocate on it, but I think out of the report, we need to, our charge is general enough, but it is
Okay.
specific to Saint-Gobain.
Okay. So then the last two, it gets a little larger, is evaluate PFAS labeling and registration requirements of products brought into New Hampshire.
Mm-hmm. Yeah, I had a
And-
bill on that. Yeah, it got hung up. I haven't refiled it yet in the early filing, but I may refile it after the election when we have another opportunity.
Mhm.
Yeah, it's
And then-
important. I'm just hoping that, you know, something like that, it was really to set up a study committee because
Right.
it could really impact commerce in New Hampshire. And I needed to understand that. I don't want businesses to be hurt because they can't get a raw material because of the labeling requirement. It's something that the federal government should do. But
Completely agree. And I have actually found that a lot of companies, well, not, I mean, a healthy amount are actually starting to label their products PFOA and PFAS free. And I really appreciate that.
Yeah.
But the last point that is in Chris's report talks about evaluating PFAS testing of agricultural products grown in the study area.
yeah, and I think that last one we can capture in with the food regulation one, that we need to really understand the impact of the PFAS contamination on food grown within the study area. I think it captures, but we need to specify that we do need to have engagement with the Department of Agriculture on that.
I agree. I actually have my own question and what kind of policy, if we should include it or not include it. And you can correct me if I'm wrong. Last week, Mike Wimsat said something that didn't really settle well with me. And I'm looking specifically in the Bedford community, that we have areas of exposure in our community that are captured in the consent decree to be tested, but not necessarily in the getting access to public water based on the new levels. And I feel very uncomfortable knowing this, and I'm very uncertain in how and what policy suggestions we could make and recommend in our report. If I heard that correctly, and I know we were all on that meeting, I'm really uncomfortable hearing that information, knowing that we have over 350 homes here that are currently being tested, and it's been resumed.
I understand that as well. And
Okay.
that has been troubling to me from the first understanding that I had regarding the consent decree. It was very limiting. The state really gave in to very quickly to the smaller boundaries and really cut
Right.
off future intervention.
Oh, absolutely, because they made it a circular zone and groundwater doesn't travel in a circle. You know,
Right.
it travels in a plume. And you could be within that circle and not be exposed to that groundwater flow. It might be going the other direction, but then you could be miles away and be exposed to it. I agree. I think maybe a policy statement that we could say would be that we strongly recommend that DES require remediation of contaminated drinking water ideally through hookups to municipal water, or the a home, like one of those point source, a point source filtration system, and cover the maintenance for that. I realize there may be some homes in a very rural area that to hook them up to public water is just not going to be practical. It may disturb some environmental habitat, some sensitive areas, but they shouldn't have to rely on bottled water. So perhaps if they, if St. Gobain is required to put in those point source systems and have to be responsible for maintaining them, even if that entails setting up a fund that they have to keep funded in perpetuity until that water tests low. I don't know if I made it clear.
I totally agree with you, but that's the problem with the consent decree.
Mm-hmm.
Yeah.
They've already ruled out that intervention by signing a consent decree. That doesn't mean we can't communicate our displeasure and what we think should be done. But I think legally, that's why St. Gobain did what they did. And they held that over DES in order to be able to get done what they already got done. The extension in Litchfield, the connections that have been done. They wanted that so badly that, okay, we'll sign anything, just get it done.
Right. And I feel like it's hamstrung a lot of, I know
Absolutely.
definitely our community.
Absolutely.
And
Now, did he say
I think there's question marks over those point of entry water systems, because the complaints, especially, going with the lower cost point of use, reverse osmosis, you have no water flow. And we're talking specifically in Bedford, everybody that we're talking about that's affected is on a private well, with the exception of Greenfield Farms. It's on MVD, but we're getting new private well testing. And I feel as though the town that we're completely hamstrung by this consent decree and in setting it up, and it becomes a town burden when in fact it is a pollution by a multinational corporation.
Absolutely.
now,
All
Mr.
right,
Chair,
guys, we have
Could
Senator
I-
Chanley. Can you say where you are, Senator Chanley, and you're present for the right to know?
Yes, thank you so much. I appreciate that. I had raised my hand to try to do that. I wanted just
we
to
can't
say
hear
that
you, Senator Chanley. Are you on mute?
I am
I can hear
not.
you.
I can hear.
I can hear.
Oh, I can't hear.
She has you blocked.
I know.
So I will speak now and then we'll try to correct
So
that problem.
I
but
can't hear her at all, Alan.
That must be on your end, because
And I
we
have
can
the
all-
beach ball. Oh my gosh, I have a beach ball. I have a Mac with the beach ball.
So it's trying to get you to listen to her.
Okay.
Shall I,
Strange.
You can go ahead for the record, Senator.
this is Shannon Chandley. I am at home in Amherst. I'm alone in the room, but not alone in the house. It's possible someone will walk through. I also did want to say, and I apologize for being late to the meeting, but I've been thinking about these issues. And one of the things I want to be careful in this report is that we're not making policy recommendations ahead of ourselves. I think
I
that
still
one of
can't, I can't hear her. I can't even go into chat. I have that beach ball. I don't know, Alan, if I should I leave?
Oh,
and-
you're actually frozen right now. So it might be you. I would leave and come back.
Okay, I'll do that.
Everybody else
Should
can hear
I-
Senator Chandley, right?
Yes.
Okay. It's up to you whether you want to wait for Rosemary or whether you want to go ahead, Senator.
Well, why don't I say what I'm going to say, and then we can certainly discuss it more. But the issue I have is just I want to be careful that that our report we're not getting ahead of ourselves in recommending policy that we don't yet have, that we haven't fully explored as a commission. And I think that the response to something that was said at last week's policy meeting is really important that we explore it. Maybe one of the things we say in our report is we focus on this rather than we recommend policy to change it if we might be a little bit ahead of ourselves. Now, I don't know that everyone would agree with that, but that's sort of where I am right now.
I appreciate your response. I just bringing it up because I find it deeply unsettling, and I just feel that it's just my responsibility as someone on the commission and someone representing the Bedford community to kind of just bring it up so that we're aware. And if it is something that moving forward in next year and what recommendations and how it kind of plays out in what the outcomes are, I think I just feel more comfortable making sure that concern is voiced.
Understood.
You know this better than I do a little bit, but I'm not sure if this was the right place. I'll bring it up at the next full committee meeting. But I just find, at least for what Bedford is going through, when we were, in the 70 to 12 parts per trillion, we have a large percentage of our population that is potentially going to be left out. So I just feel it incumbent upon me to bring it up.
Sure. And others may agree. I mean, I absolutely think that's an issue to be addressed. I'm just not sure that the commission is ready to make that commitment in this report as of November 1st. Maybe we are, but just want to.
Senator Chandley, can I ask, just for clarification? So when we are talking about establishing a policy or recommending legislation, is it your suggestion that at this point, we should say further study needs to be done in order to, in the future, possibly make a policy or write legislation?
That is where I am on this. Oh, let me make sure. That is where I am on this issue. I just was checking to make sure I was unmuted. Only because we haven't discussed it as a commission. However, when we hold our next meeting, people may be willing to move forward on this. I just feel like that policy has not come up to my knowledge in any of our prior subcommittee or commission hearings. So that's the only reason I don't want to get ahead of ourselves as a commission. But I do think it could be reasonable to note that in our report so it doesn't go unheard, and it doesn't prevent someone from putting forward legislation to do that. So I just, I'm trying to make sure that we're kind of following the process that we have in place and making sure that any recommendation we make can be supported by the entire commission, or I would like it to be supported by the entire commission if we make a recommendation.
I think that's fair. And and others can speak up. I think it was really just brought up last week since we've kind of just had all of this ruling come down, and I will most definitely bring it up at the full commission meeting. It's just that it was a little, again, it's unsettling to just get that information. It kind of felt like it was just like dumped in the policy meeting, And we also didn't have that information in the full commission meeting, but I can stand by that we make note of that and bring it up at the full commission meeting. So I'm okay with that if others are, and it,
That's,
you know, it's up for discussion.
yeah, that makes sense to bring it up at the full commission meeting. I'm good with that. Thanks.
And was that on the topic of the response, the consent decree, and where that zone is for St. Gobain to provide drinking water?
Yes.
Yeah, that was
Oh,
my
okay.
concern. Yeah.
Oh, okay. Yeah, I'm sorry. I had technical difficulties. I had to leave for a few minutes.
Yeah, no, I was just saying, Rosemary, that I have real concerns and I'm not sure how to address it about the fact that the consent decree, you know, and if I was understanding Mike Wimsatt correctly, it will get water supply to those when they signed it at 70 parts per trillion, but now we have a 12 part per trillion, and we have a lot of homes in Bedford that are going to fall in the in between, and they'll get no guarantee access to a municipal clean water source when they fall in that. And I find that deeply unsettling, and I'm very uncomfortable with it, but I don't know how and what we can do and where we and what we should do and the direction we should go as a policy committee, and frankly as a commission as a whole. Because, you know, it was a 1.5 mile radius, but then the consent decree goes further and we have more homes closer and deeper into Bedford that are being tested, but there's no guaranteed solution, as there were for most, you know, the communities in Litchfield and the 61 homes in Bedford, and, you know, the ongoing issues that you're facing over there in Merrimack. But there seems to be attention at least given to that. It appears to me there's not going to be much attention, and becomes a town burden based on the consent decree that we are kind of stuck in.
Yeah. So that will be a topic of the next full commission meeting. And I'll make sure Senator Deitch knows to get that on the agenda.
Thank you.
Yeah. All right. Ms. Paradise, do you have any other recommendations from the Environmental Committee?
No, I just added that last one. Again, to repeat, the final recommendation was evaluating the agricultural products. And that's
Okay.
when I followed up with my concerns about the consent decree and
okay.
where do we go from there?
Okay, got it. All right, so we've got all of the, we've captured all of the policy and recommendations to go forward from the environmental and health subcommittees, plus our own from the full commission meeting. Do you want me to just run down them quickly, or Nancy, you've been taking notes. I'm just wondering, do we need to review them, or can we just take the notes and then just bring it forward to the communication committee?
Well, I have a question prior to that decision. When a report was made from the environmental subcommittee, I did put down that 5, I believe, have. In our report, I would like to suggest that we write down that we support the environmental recommendations related to source of contamination, migration of contamination, remediation of contamination, and the agricultural, and just make a statement and then refer to the environmental report. Is that reasonable?
Well, when I was listening to Ms. Paradise about the sources of the environmental contamination mitigation, I think I'm seeing those are going to be things that need to be included in the commission report, but they're not necessarily policy recommendations. It's pretty much a statement of what we've learned and
Study and
kind of the
continue to
scope.
study.
Right. In fact, I
I'm just
don't.
looking for guidance as to.
Right. Really, the only policy recommendations that I'm seeing coming out of that the environmental subcommittee would be expanding the communication that we receive from DES and DHHS to include new information about environmental studies or things that are going on or technologies that we want that to be communicated to us too.
And that can be incorporated into the
Into the-
recommendation we've already written,
Right.
which I have. That's number 5.
Right. So we would go beyond just health communication improvement to include environmental information improvement.
Health and environmental issues. Yep.
Yeah. And then the other thing that I captured from the environmental one that would be under policy would be to expand the scope to include Londonderry and then add a town representative and a citizen representative to the commission.
Okay, which we already did as well. But we can say that it was recommendation made by the health and environmental. Because we
Yeah,
already did that.
Yeah, in fact, I'm seeing that the final report, Nancy, we wouldn't say, oh, this is attributed to this subcommittee. I think all the recommendations are just going to come from the commission.
Okay.
It's just they got to the commission through the subcommittee.
Mhm.
Now, the other thing I think you said, Ms. Paradise, you mentioned the HF scrubbing. Did you mention that as far as the remediation? We have had some discussion. I don't think it was at the last, it might have been like the 3rd or 4th commission meeting we had, but I think we had discussions about the concerns that the town of Merrimack brought forward to challenge the air permit. And do we want to make a statement that we recommend that DES adopt town of Merrimack's recommendation for changes to that air permit? If you remember, the town of Merrimack is submitted a petition to DES to include the installation of an HF scrubber to the reactive thermal oxidizer. They also asked that the retention or the residence time of the air emissions be increased that goes into the RTO. And I forget the other, and then if the manufacturing process shuts down, that the RTO still is, as long as there's air emissions, that RTO has to be maintain operation. Nancy, you probably know
Has
that.
to stop operations. Has to stop operations until remediation.
Right. So that if the RTO is shut down, manufacturing operations have to shut down.
Correct.
But I wonder, in this commission report, should we make a statement about those? Should we make a recommendation that the state adopt those?
Or to support the town of Merrimack in its appeal.
Right. Mm-hmm.
I don't know, is that a policy issue? Or is that a commission
Yeah.
consideration?
It's going in front of the Air Resources Council. But I don't know. We can probably bring that up in the communications committee.
Yeah, I was going to suggest that maybe I think it can be brought up to the communications commission and committee, and put it on, mention to the chair that we should probably discuss it at the full commission hearing.
Yeah, that sounds good. Okay, so does anybody else have any other anything that we didn't touch upon? I know this has been a long meeting, but I think we've done a good job identifying these policy and recommendations to send forth to communications.
So I believe we have 13. Is that what you have, Rosemary?
Let me see.
We'll get together.
Yeah, maybe we can get together. You can just send me a draft of what you have, Nancy, and then I'll get it. I'll compare it to my notes.
Okay.
And then is this something, and I'm asking, maybe it may be someone other than us who needs to answer this question, but is it ordinarily on a commission report, members have to sign off, but I don't know that on the subcommittee report, we need to sign off on the report. That's my question. I don't know if Alan Rath can answer that, or anyone else might have a sense, or is it just more, a less formal report.
Can you repeat the question? I'm sorry, Senator.
Sure. I know that when the commission submits its interim report, each commission member will have to sign off on it. But in terms of the subcommittee reports that are going to go forward, that isn't something we need to sign off individually.
No, I don't think there's any requirement that you do that, considering that the subcommittee was set up as something aside from what statute called for. So as far as you all signing off on the actual report, that is what's going to have to happen. As far as subcommittee goes, I think that that's up to how you internally would want to govern, that you are okay with the report. So I don't think that that's necessary.
Okay, great. Thank you.
Yeah, I don't think so either, Senator Chanley, because we don't even approve minutes. We just submit notes. So we're really, I consider our subcommittee more of a working group, like
Right.
a breakout group of the commission.
Okay, great.
Okay. Is there anything else anyone wants to discuss or bring up before we adjourn? Okay. So Ms. Harrington, you'll circle back with me just to make sure your notes are consistent with what I've taken. And then I'll make sure they get to the communications committee. And if there's nothing else, I'll entertain a motion to adjourn.
So moved.
Okay, we have a
Seconded.
second. Okay,
Who was seconded?
Shannon.
Okay.
okay. And I think we need to take a roll.
Correct.
Okay, of those present, Ms. Paudry, 40, sorry.
Yes.
Harrington, yes. Ms. Paradise,
Yes.
Representative Rung,
Yes.
and that's everyone, is it
And-
not? Oh,
Mr.
Representative Chanley. Sorry about
Yes,
that.
yes.
And I will make in the note that you entered into the meeting at 11:37.
Okay.
Okay, great. Thank you, everybody, for your great participation. I really appreciate it and hope you have a great day.
Thank
Thank
you.
you.
Have a good one.
Thank you.
And thank you, Alan. Bye-bye.
No problem. Nancy, I will send you the link for YouTube right now.
Excellent, thank you very much. And Rosemary, I'll be working on that today.
Okay.
Thank God knock on wood. Thank God.
Well, I'm around all day, so if there's any help or you want to, get on the